So, really great of everyone to join us for this fourth session, and the culmination of our four-part series of a community of discovery. And we'll look at what that means through all of our presenters from the whole series. But I want to kick us off by starting where we finished in the last session. So in the last session, Jan talked to us very much about the light that sheds light into a darkened room, or other rooms that are darkened, but light from other rooms peering into that one. And there was a message from Tim in the chat last week that it was much like Dumbledore, that happiness can be found even in the darkest times. And if we think about the power of appreciative inquiry in that statement alone, that message of appreciative inquiry giving life, not necessarily always focusing on the positive elements, but looking at our strengths and looking then at how we have opportunities to move forwards and be what we want to be. And then the second part of that quote from Albus Dumbledore was, if one only remembers to turn on the light. And I think my message with that one, linking to Jan last week, is that sometimes we need somebody else to turn on the light for us, because we might not have that or be in the place where we're able to turn the light on ourselves. And that's really important. And that was mirrored equally last week, but in the chat, where Jan talked about the glass being half full or half empty. And he said, well, actually, if you hold the glass out at arm's length, and how much does it weigh, that actually if you're holding that glass for quite some time, that actually it becomes quite heavy. And somebody in the chat said, we don't always know where to rest our glass. And then I think it was Nikki Calthorpe joined in and said that actually it's about supporting other people of resting their glass in a safe place. And I think this is much the same, that appreciative inquiry gives us the courage to help others, and to also shed light in darkened rooms to help one another. So in this time, what we've seen during the series and the last few months is that there's mass change ahead. And actually, with that mass change, some of that, quite a lot of that, has been imposed upon us in health and social care settings. And it's really important that we have that ability to stop and pause at times. And there's a moment coming quite soon between that peak of COVID and then moving forwards beyond COVID, of taking some time to really take where we're at. And equally on that, it's thinking about that notion of systemic change. So in order to create that systemic change that we've seen over 3 months, there will be aspects of that we naturally want to hold on to, and there'll be elements of that we don't want to hold on to. But what's most needed during that time is an element of resilience, moving us from a place of our resilience during the peaks of COVID to our resilience of balancing between patients coming in, still presenting with COVID-like symptoms, but then moving back to outpatients or in care homes, moving to families, revisiting the homes at some point, so that people get their loved ones back with them. And I'd ask a question in my mind that's been presented or thought about the last few days more and more, is people were offered to share with us any of the topics or concerns or questions that they might have.
So I was looking at prescriptions for HPV vaccination.
Some of those descriptions, some of the questions that came through to us.
So what Anura said was,
harness that element of change. How we understand that we need to pause on some elements, and that some elements we'll stop using, but others that we want to carry on. And that's really key. So I'd ask you, what is the one thing that you most want to keep or continue post COVID-19? And that's a thought for us all. And welcome you to add to the chat. So what one thing do you most want to continue post-COVID-19? And I think it's really important on that point that we take stock of where we're at, that there's lots of evaluations of responses in trusts and social care settings that will form part of our next phase, if you like. And it's really important in that we reach out and engage with stakeholders. So whilst you're all thinking about that one fundamental change that you most want to keep post-COVID-19 that you has presented and shone light in your lives at the minute, I'm going to move on to resilience. Because for me, what summed up this series is that when I've read back in the chat, there's been uncertainty, fear, and anxiousness, and it's having that time and space sometimes to understand that actually the dark sky brightens our resilient conversations. And we've talked a lot in this series about conversations being integral to appreciative inquiry and using those two sort of approaches that we've come to know so well with generative questions. So we've asked lots and lots of questions during this series where we've pulled that in the chat, but equally then for you guys to reflect on moving forwards of how you change or how we use some of those in our personal lives or in our teams, in our organisational cultures, etc., for that systemic change. And the second of that is the ability to reframe. And in that first series session, I gave you a number of reframes that we had pulled together in the AI world. One, we're not socially distancing, we're physically distancing but socially connecting. We're not looking for a new set of norms, we're looking for our undiscovered ordinary. And there are some of the reframes that will help us and guide us in the months that come to pass. And that's really, really important. And there's a story that I want to share with you, which is personal to me. So some of my friends and colleagues on the call will know this, but others of you won't know that I suffer with arrhythmia seizures. So my first seizure was when I was 16 years of age. A time when you're thinking about going out with your friends and growing up and moving into adult life. And I remember that first seizure being like this boulder that had been placed on my back, wondering what was happening. Somebody so stubbornly independent, wanting to go and do things but couldn't, because then the seizures came more often. The chest pains came a lot more often. And I was very quickly finding myself in that darkened room, not feeling very resilient at that time. I was pretty lonely in the sense that I didn't want some of those conversations, those generative conversations. And certainly when that moved on and doctors sort of eventually diagnosed from thinking that it was epilepsy to moving through that it was arrhythmia that was behind this, that actually I wouldn't potentially drive for quite some time, if ever, because of the seizures. And the one thing I always wanted to do was drive. As a boy, I was mad on toy cars and just wanting, you know, the lad that has the first car and drives their mates and you go on a bit of a holiday somewhere in the seaside areas. That didn't happen for me. And actually that was, Jan reinforced this last week with the story of his wife, and that really captivated me because I felt it. I was this lad in my teen years, full of energy, but one minute I'd be standing up straight and the next I'd be on the floor in full seizure. And those seizures came more often, and I saw what it was doing to the people around me. I equally saw how independently stubborn I was becoming. I was closing myself off from the world and not willing to change with the seizures. And now I'm 32 and I still have the seizures, far less of them. But now I accept that they're part of me. So I might have a chest pain every now and again, but I've been blessed to have people around me in all forms of my life, whether that be in work, my friendship groups, my family, that have actually helped me rest my glass at times of difficulty, or that they've helped me turn on the light when I didn't know how to. And I think it's during those moments of adversity. I spoke in the first session about appreciative inquiry and the tragic. And actually, a lot of my practice of appreciative inquiry has been in the tragic. But then you allow something to flourish out of the darkness into the light. So you let the dark skies brighten our resilient conversations. And that was never more important than the model from Joan MacArthur Blair and Jeannie Cockrell that actually said that resilience was about three things, or three states of mind: hope, despair, and forgiveness. And that actually all of these three states are interconnected. And we move through them at various different times, with the hope circle being bigger at certain times or the despair being bigger. So in COVID, what happened, in my opinion, was that when that came about, there was this great sense of despair, of not knowing where we were going to be, what we were going to be doing, whether the NHS and social care would survive, because we'd seen other countries where it hadn't. And actually, we needed that place of hope. So the tree on the left is not just any tree. So the tree is called the survivor tree. And last year I went to New York and visited the site for 9/11. And absolutely, again, the tragic time that was 9/11 brought so much inclusive, diverse conversations because of this one tree. So this tree was there pre-9/11, and in the smouldering ash of everything that fell around it, that tree was the one thing that survived on that whole site. And standing in front of that tree was one of the most humbling moments of my life. And that reminded me again about that shift to hope. That even in times of despair, there's so much hope. And we've seen that with so many of us, and the claps on a Thursday night, or, the things that you've heard during this series of working differently in adverse times. But actually then seeking that forgiveness to go one step further and add to systemic change. And I think the key with resilience is that it's not universally that we're resilient all of the time. At times we feel that resilience deserts us. And I felt that with my seizures and many times afterwards, and I'm sure each of us can connect that resilience at times has felt deserted. But actually, what we need to do more of is practice. And you'll notice in the model that there are a number of appreciative inquiry tools, so appreciative leadership, appreciative inquiry, appreciative principles, and then that notion of being AI. And actually, what I'd hope that we move forwards with is this greater sense of connectivity, of generativity, that we're able to talk to each other like we have been during this, and help one another move through those three states or elements of our own mind. The question that I'd like you to reflect on, and obviously you'll get the slides at the end of the session, and this might be a personal reflection for yourselves, is what is your soul calling for you to see and do during COVID-19? And even beyond COVID-19, what is it that your soul is urging you to do and see more of? And I think this series is really key to some of the work that's going on all across the nation now in terms of bringing together generative questions. At this point, I just want to just check if Alison's still on the call. If you are, I'd like to hand over. If not, I'll carry on and try and do some justice to Alison's slides.
I think you're going to have to take over, Dan.
Okay. So I definitely won't say this as beautifully as Alison would. However, during Alison's conversation about the power of narrative, she talked about choice. That we have a choice about how we hear stories, about how we frame some of those stories, and then equally about how we adjust our response. It's very easy sometimes when you're in that darkened room to respond.
I didn't catch that. Could you try again?
To respond quite quickly to somebody from a place that's not, appreciative at that time. And the key there is the gap. So the gap is essential because what we're finding during this time, and Suzanne's going to pick up on this more as we run through the session, is the need for us to have time for ourselves, the need for us to have time with our teams, and time within our organisations to create the cultures that we want to create. And you do that by having the sorts of conversations that are generative, that are reframed, and that we continue practicing this as we move forwards. But equally, that we open ourselves up to that diverse range of stories in the first place. And then when we hear a story, that we don't just hear the words, but we hear the person as well. And then Alison moves us on then to this graph. And we've become used to seeing graphs, if any of us watch these daily briefings. The relative importance in 2020. And what we will see is that our notion of genes sort of dropped off. And I think for some, it probably increased as we remotely worked. I certainly know I'm not suited and booted as I normally would be. I'm in my genes every day. I can't speak much about bras, but, I'm sure that people can associate with some of that. Equally, then when you look at what happened with toilet roll in the graph, that there was this bulk buy of panic, and then actually that started to come down as supply chains met our demands once again. But equally, the most sort of pertinent one in that image is masks. So still, we can smile that actually the guidance that we've got on masks at the minute is still quite confusing and we don't know where to use it, etc. So the line goes a little bit chaotic. And actually, the use of appreciative inquiry in the chaotic times is really quite nice, because that's where you really start to practice some of that and have those more diverse conversations at those points. At this point, I'm going to take a stop and pause. And I just want to check in with the chat at this point to see if there's anything pertinent that's come across. Helen, Jodie, if there's anything that you want to share at this point that seems to be coming across.
I think you opening up about your story and sharing, Dan, has just made people really thankful about the people really listening to stories and getting to know people, not just that sort of work, oh, hi, how are you doing? Whereas you're not really asking that, moving on. And I love Emma P saying about her street now has a WhatsApp group, whereas they probably won't come together, and it's something similar for us. Our street are now having street parties for the kids where their birthdays are because they can't have them indoors. We'd have never done that before.
It's those lovely images. So Helen, on the first session, you talked to us about music and imagery. And I've got some images later on for you. But those images that we keep moving forwards are so, so important to us. At this point, I'm going to hand over to Caroline to take us through her sort of thoughts of how we use appreciative inquiry moving forwards.
Thanks, Dan. For those of you that were on the webinar, the second webinar on the 27th of May, I shared how my appreciative inquiry story really of how I've used appreciative inquiry in care home settings. And I started off with just developing some appreciative conversations in care homes to elicit positive dialogue really. I then built on this with a more challenging application in a care home that was experiencing adversity in terms of leadership, which had impacted on the safety culture, staff morale and the quality of care. We used some of the techniques from appreciative inquiry, so getting teams to identify their individual and team strengths and did some visioning with them to start their restorative journey, which was from a CQC of 5 inadequate ratings by the CQC. And
Caroline, just if you could speak up a little, I think.
Sure, yeah. I'll
Thank you.
Yeah, and over the course of the year, with lots of input and positive framing and visioning with the staff, it actually resulted in them achieving a 5 good ratings. So that was the sort of start of my use of appreciative inquiry in care homes. We then moved on to, more recently we've moved on to the COVID-19 situation, and if you remember in the second webinar I shared some generative appreciative questions that we shared with care homes across our region to help capture the ways in which care homes have risen to the challenge and a way of capturing and recording some of the positive changes and new relationships that have emerged from COVID. The general feedback from managers was that they found these really helpful, and particularly as an additional way of supporting staff resilience. And I've had some feedback from the care homes in responses to the staff responses to these questions, and I sort of put these into what we call a SOAR framework, SOAR framework, which stands for strengths, opportunities, aspirations and results.
You're dipping out again slightly, Caroline. Sorry.
This is the SOAR framework is an asset-based version of a SWOT analysis, which focuses on strengths and opportunities for individuals and organisations, and is much more powerful and effective if we focus rather than focusing like with the SWOT analysis, which focuses on deficiencies. And the next slide reflects this, the findings that we had. So there's a lot of information on this slide, but some of the things that I'd like to pick out are firstly around the strengths. So staff commitment, honesty, flexibility, caring and kindness for residents, families and each other. It's a real feature of some of the feedback, along with a real improvement in safety culture and staff being given the opportunity to think of their own solutions, so lots of staff-led initiatives. In terms of opportunities, we saw things like staff wanted to do their own peer infection control audits to help each other pick up where they might not be doing so well with infection control, to help protect each other, and they welcomed that. There was the introduction of things like appreciative reflection, and there was lots of opportunities for increased engagement and connections with local communities. Those opportunities really came out. In terms of aspiration, this is sort of the dream phase of appreciative inquiry. Staff really reflecting on the fact that there has been this is long overdue, the focus on the importance of care homes in our health and social care context is long overdue, and they hope, you know, that there's an aspiration that this will continue post-COVID, and it's really put them in the spotlight. And also
Caroline, if you try and stay closer to your laptop, moments that it was really, really clear again, but then it clips out, unfortunately.
The importance of supporting staff's mental health and safety, real aspiration that they wanted that to continue. And in terms of results and resources, there's been a real embracement of new technology, and also there's been in the initial stages there was a lot of sharing of PPE with other providers that hadn't, you know, the care homes were really sharing their resources that were in scant supply. But finally, the text in white, one care home manager said, I knew the staff cared, but I never appreciated just how much I've been humbled by them. So these are examples. This is the feedback that we've got that has been put into a SOAR framework, which shows how our care homes are soaring towards the new normal of COVID. So next slide, please, Dan. Actually, just before I move on to the next slide, the SOAR that I've shown you on the previous slide is an example of a team approach. In this case, a collective analysis of multiple care homes' feedback. But it's important to note that SOAR can be used by individuals as a springboard to help improve well-being, starting with identifying individual strengths and then identifying opportunities that are available to you. To dream where you want to be in the future, that aspiration, this can provide a real platform for framing potential and achieving the purpose.
Caroline, I'm really, really sorry. The sound dipped again. If you come closer to your laptop again.
Better. Is that better?
That's much better. If you try and stay as close as possible to the laptop for this final slide.
So, use of a SOAR for individuals can help you tap into the resources to help you achieve your goal. And interestingly, this has some similarities to the methodologies used in quality improvement science. So things like setting aims, reviewing processes, and using things like driver diagrams, which is essentially a plan to plan your improvement work. So last slide is one I want to share in relation, and it relates to creating lasting positive change. And it's interesting and gratifying to note that many of the themes that emerge from the care home's response to COVID-19 bear striking similarities to those acts that can and may lead to positive change. So gratitudes, being grateful for, you know, the caring and kindness that's been overwhelming in care homes, random acts of kindness that we've heard from, you know, all walks of health and social care and society in general. We know from positive psychology literature that all of these acts are acts that individuals can take forward to support resilience, and developing a vision for what the future for the future requires reflection about what we used to do and what we do now. So what will we leave behind and what will we retain and sustain? So for me, I think COVID-19, the pandemic, represents quite a milestone point in time for the future of care homes, which will require both policy and whole-scale societal attitudinal changes if we are to move forward and maintain the person-centered care that we want to deliver. And at the bottom of my slide, I've put the image of a butterfly emerging from, you know, from caterpillar stage through chrysalis to a beautiful butterfly. And this is quite powerful for me, because when I first started working in care homes, which was about 3 years ago, my perception of them was quite towards the left-hand side. You know, that a lot of the press that you heard about care homes was quite negative and distasteful. But I think COVID has provided an opportunity for the transformation of care homes into the beautiful butterfly, as places with people, staff and residents to be valued and admired, because they are really at the centre point of our health and social care system. That's it from me. I'd like to hand over to Sally and Amanda now for their reflections.
Thank you, Caroline. Hello, my name's Amanda. At an organisational level. Our area of appreciative inquiry practice is in healthcare, both as doctors and an anaesthetist, and we both work in the Oxford region. So on our first slide, you can see there's a lot of negative press, and I just wanted to come back to this, and I alluded to it in our first webinar. In some ways, actually, it's been quite easy to change the conversation at work. We've managed to shine a light on the strengths to help promote positive change. The overwhelming negativity and death-focused press has become fertile ground for the avoidance of negative chat. There's really no space in our minds or hearts for more negativity. We have it on the news, we have it in the newspaper, and when we come into work, we're less likely to focus on the negative because there's so much out there. This is why we didn't have the bandwidth to talk about why things weren't working. What we've found instead of focusing on activity, focus on rainbow. Could I have the next slide down, please? So using appreciative inquiry during this pandemic has allowed us to take grip. We mentioned last week how the acceptance of change has allowed projects to flourish in a really short period of time. If we can take our hospital as an example, change was always a slow process, and to a certain extent still is. And in fact, AI in our institution was more likely to be associated with artificial intelligence rather than appreciative inquiry. But now Safety 2 and appreciative inquiry are becoming part of our language. They're part of everyday conversation. In fact, just recently I learned that one of our nurses here has based her PhD on appreciative inquiry, and more importantly on learning from what works in the intensive care setting. It's early days, but it's exciting. And if we keep the conversation going, we could change hearts and minds. So before I hand over to Amanda and remind you about how we implemented projects in our hospital, I just wanted to allude to why it's such a good method to use, why appreciative inquiry works. To build a team, we don't break it down and then build it up again. So there is scope for learning from mistakes and building a team from what didn't work, but strength-based approaches have a much greater influence on the brain. In fact, there's solid evidence from MIT, from Professor Earl Miller, who challenges the concept of learning from mistakes in his research as a neuroscientist. And he shows that success has a much greater influence on the brain than failure. More importantly, it has a lasting effect. If you want lasting change, you need to engage with everyone. And I'm just going to bring you to a more recent article. So yesterday, the King's Fund published an article from Susie Bailey and Michael West on leadership in the COVID pandemic. And I wanted to share this quote with you. The past few months have taught us that staff must have autonomy and control, feel a sense of belonging, be supported in order to have a sense of competence, rather than overwhelmed by excessive workload. And I think it segues nicely into an old proverb that says, if you want to walk fast, walk alone. But if you want to walk further, walk together. Next slide, please. So I'm just going to leave you with one more thought. I recently heard Jane Goodall speaking on Radio 4 about her life as an animal rights activist. She spent her life shining the light on chimpanzees, protecting their habitat as an animal rights activist. And there was one statement in her interview on Radio 4 that really resonated with me. It described the Appreciative Inquiry philosophy so well. She said, if you want to change people's minds, then you need to reach their hearts. She made more of an impact by showing people videos of her research with chimpanzees than arguing with them about why they shouldn't test on animals. That strength-based, heart-based approach that I know Suzanne and Tim will allude to later on in the presentations. So, if we can show our colleagues how they work well together by promoting a positive conversation and refocusing our lenses on what works, then there's more likely to be a lasting change. And more importantly, a change that they want to be part of. So I'll hand over to Amanda, who will share with you how you too can take Appreciative Inquiry into your workplace by asking the right questions, generative questions. You can change the conversation. So remember, based on what Dan said, that shining the light on your strengths, understanding your strengths, and exploring an institution's strengths can promote a lasting positive change. Next slide, and to Amanda.
Thank you, Sally. So you heard 2 weeks ago about our Appreciative Inquiry journey, our work in individual hospitals, but also as a regional group. How one conversation about wanting to hear about a COVID recovery helped to change the email content of an institution. The information shared in our department changed from being about staffing issues, more admissions and deaths, to what we were grateful for and that patients were recovering. We wanted to hear more than one story. We wanted and needed to hear about life as well as death, about staffing issues and staffing successes. Next slide, please. Hanging posters across the hospital and asking teams what they are grateful for and what they are proud of took the conversations from emails into corridors at work. The coffee room, the corridors, the maternity ward, the car park. Ask your team members what works. Surprise them by focusing on their strengths and what brings them joy. You can learn from mistakes, as we should, but you cannot build from mistakes. You can only build from strengths. These are the foundations of positive change. Thank you. We're now going to go international, and I'm going to hand over to Jan.
Okay. Thank you very much, Sally and Amanda, and good afternoon from Belgium again. So I would like to take it a bit further than from where I left last week on the third webinar by exploring some topics where you could apply the techniques and philosophy of appreciative inquiry. Next slide, please, Dan. In Belgium, quite recently, the organization called De Zorg Samen, Zorg meaning care, they did a, what you call it in English, a sort of a review, a questionnaire, asking staff how they are doing in the care and healthcare, social care, working staff. And they found some results, and I'm referring now to the Belgian results, but from what I gathered this morning when I read some information about a recent investigation in the NHS, there might be some similarities that you recognize. Anyway, so more than half the people that replied on the questionnaire were saying they're feeling pressured, they are exhausted, they are hyper alert modus. 4 out of 10 are experiencing shortage of sleep. 15% is considering to quit their job. 22% is having doubts about their knowledge. 83% find support with their partner and would love to have better support from their leaders. 23% experiencing problems concentrating, and 24% of the respondents experience moments of fear. Okay, so next slide, please. 36% of the report reports feelings of guilt because they could not do the job as they wanted it to be done. And when they are looking for a supportive conversation with their leader, 34% of the staff working in hospitals found this conversation a positive experience. You could say 34%, or you can say only 34% find it a positive experience. Now, I would like to take this topic on getting support from your supervisor or leader or manager. I want to take that one step further by looking into that or questioning that. So next slide, please, Dan. Now, I would like to ask the question to you as a staff member, and I want to ask the question to you as a leader. As a staff member, I would say bring us back to a moment where you as a staff member felt really well supported by your leader in the face of difficult times. And for you as a leader, if you are a participant and you are in a leader role, bring us back to a moment where you as a leader felt you really have supported your staff very well in the face of difficult times. So if you are in such a moment in your memory, there's two questions. And I would like you to think about these moments and think about the answers and write them down in the chat if you want. First question is, what were the key ingredients that made this support so well? I mean, if you're a staff member, what were the key ingredients of that supportive conversation you had that made this support function so well? And the second question is, what are then the top behavioral practices related to these ingredients of success? So if you can take a moment to look into how did I, in difficult times, felt supported by one of my leaders, or I felt that I really supported one of my co-workers. What were the ingredients and what were the practices that you found out? So if you could take a moment and reply on that. Okay, so I saw lots of replies going over the screen, but Helen, are you keeping up with the vast amount of replies?
I think Helen's now having a problem with connectivity, but some that I captured during the ever increasing chat was the need for no judgment in support, the need for active listening and real listening that links to that still presence, where we're in somebody's time, that you allow that to be their time, genuinely. A time of respect, but equally a time of humanity, being human and understanding and listening to one another, and their stories and what makes them them. Jodie, was there anything from yourself that you picked up in the chat?
No, I think, Dan, you've picked up the main ones. Earlier on, I think we've got some questions, but in relation to the 2 questions that Jan has asked, I think it's honesty, giving time, relationships, really that relationship between both the person who felt supported and also the person as line manager, so from both sides.
Okay. Yeah, what I want to add on to that, and I come to that when I talk about the different domains for AI approach as well. But I think in these times it is not easy for staff, and it's not easy for people who are in a supervisor or managerial role. And if we can accept the fact that it's hard for everybody, then that gives some sort of empathy. But at the same time, I think this is an enormous opportunity for people to further develop and having breakthroughs even in their leadership skills. So this is a really opportunity for leadership development, in fact, and also for development for all staff members, I would say. Yes. So maybe we can go to the next slide now, please, so that I can try to cover some potential domains for an appreciative inquiry approach. And as I state there on top of the slide, this list is obviously far from complete. But let me just take you quickly through the possible topics that I could sort of like list there. Is the first one is conflicts. Now, you can ask when people are facing a conflict, you can have that in a team or between 2 people, is to have appreciatively inquire into the relationship. For instance, what is it that you appreciate to one another? What is the shared desire state that you want to obtain, and see where are the commonalities in your desired state for the future cooperation. And what I would like to suggest there is to go really to the level of what are the daily practices that we are going to do or having to do to live up to that shared dream. And it really works. I have examples of that, where I did facilitate on severe conflicts, but by changing the lens to appreciative inquiry and through the process, we had some great results. The second one is the topic of team building. And as we've heard before, this crisis, this pandemic, have really had an enormous team building effect. And what I suggest, and I even suggested it last week during my presentation, is to organize a dream building after having the members of the team analyze the successful teamwork as to what has emerged, what positive things have manifested themselves, what do we want to keep for the future, what is then the better version of cooperation as we have experienced it so far, and how can we build on that. The third topic is well-being. It's about clarity, seeking clarity in your personal well-being challenge. What is my personal challenge with regards to my personal well-being? If you get that clear, what is your challenge on that? That will help you to live up to that challenge, right? For some people, the challenge is different practices on switching off between home and work. For others, it might be very physical practices that needs to change or needs to improve. And in your team well-being challenge and organization well-being challenge, try to get clarity in that as well. What is our challenge as a team? What is our challenge as an organization? And if you can have a shared challenge and bring that down to practices, then you can have conversations and helping each other to work on that in a generative way. The fourth topic that I think of for AI approach is knowledge management. I guess you could bring all stakeholders in the room to do an appreciative inquiry on knowledge management in your team and organization. How is our knowledge management working today? What have been successful practices in our knowledge management, and how can we take that further to the future for an even better way of doing knowledge management? So that's another topic. The next one is talent. One company asked me, we are having engineers, this was an engineering company, and there was engineers leaving the enterprise. And they asked me, can you come and help us close the gate so that people are not leaving us? What I did with the appreciative inquiry focus and with the appreciative inquiry lens, we changed it from how can we become a magnet, a strong magnet for the talents that we need. And you can sense the difference between how can we close the gate so that people are not leaving versus how can we become a strong magnet for talents that we need. And that shifted the entire way of talking about the challenge and about all levels jointly thinking and discussing how can we become a magnet for talents. And that works. The next one is obviously the leadership topic, as I said. I would like to quote there Jervis Bush, who is a great thinker on organizational development, leadership development, and in fact also appreciative inquiry. What he says is leadership should focus on the process and let stakeholders define the change. Too often, it's the leaders that define the change and then try to sell it to their staff for them to become enthusiastic to implement a change plan. What Jervis is suggesting, and I can fully agree with that, is leadership role is to focus on the process of gathering everybody together, getting clearer clarity on what the issues are, what the challenges are, what the SOAR is for the organization, and build on that. And the next topic is what I call de-victimizing or de-complaining. I don't know if that's the good way of formulating it in English, but what I mean there is when someone is in a systematic modus of self-victimizing or complaining, ask the person to describe that as a positive challenge. Try to reframe the being a victim to a positive challenge. When somebody is complaining, ask the positive challenge. Ask for examples in their daily practice when the situation was already going in the direction as they would prefer rather than what they are experiencing now. So it's like the dream building I was referring to, is make them think about what is the positive image. What is the image that I would like to live up? What gives me energy? And then ask step by step, what would be one small step to take you on the path towards reaching a better state of whatever the topic is. So those are some issues, some domains where I thought appreciative inquiry as an approach and a philosophy does work, and obviously the list is far from complete, as I said, but that is what I wanted to share to make sure that you think about broader sense of working with appreciative inquiry. Now, last week, I was particularly touched by what was said and reactions that I received afterwards as well. And I would like to share with you, as Dan stated, I'm a poem writer as well. And if you bear with me, I will love to share a poem I wrote after last week. And it's a poem I would like to present to you, honoring the health and social care workers around the world. And let me see if this works. Okay. So let me get this check. The title is, Can You Hold Her Glass for a Minute? Can you hold her glass for a minute, please? Right there in front of you, yes. So she can tell you what's inside. Can you hold it for another minute or so? It's not just her story that rests in there, stories transparent you might not see. Can you hold it some more time still for her? Because maybe her glass is half filled with feelings of guilt for not always being able to work side by side with them, helping at the front line to change the tide. You're still fine to hold this light-weighted glass? Because some of the colleagues are no longer there. They too fought a virus outside the public's eyes. Altruistically, they all tried their best to save and comfort precious human lives. Some you might even know their name. I'm so grateful you're holding her glass for a while, allowing them to look back proudly on all what they made possible during this impossible. Let us enable these caring heroes now and tomorrow, so they all can convincingly say, from this misery we shall try to grow. I'll take her glass back. Thank you very much, my dear, for lending her your arm and your quiet listening ear. So with that first poem I shared, I would like to thank you for your attention and give the word now to Suzanne and Tim.
Good afternoon, everybody. This is the first time for Suzanne and I to share with you following the amazing journeys. People shared their stories, their excitements, and their challenges. My name is Tim Slack. I'm the one part of Appreciating People. My background is not in health at all. It's regeneration and youth and community work, and my entire career was spent working in inner cities and outer housing estates. So poverty, my kind of working in the areas of poverty has been my main challenge. So I've been working with AI for 12 years, and with my wife Suzanne, as many of you know her, and me, we started Appreciating People.
And I've been privileged really to be part of training. There's quite a few names I reckon in the chat. So for the last probably 4 years, I've been supporting NHS training and working with safety and the concepts that are behind Safety 1 and Safety 2. So those of you who know me also know that I always tend to start in these very emotional ways. And I thought that I might not do that on Zoom, but now that Jan has read his poem, that's really opened up a great big space in my heart for it all. So thank you, Jan. That was really lovely. I think it spoke to a lot of what people are feeling.
You're welcome.
So I've got a few slides, and I think what I felt like focusing on, because there's such appreciative inquiry expertise in the group today and the wonderful presentations we've heard, where it's being practically applied by people that I really admire. I don't think I can add too much more to AI, but I did want to focus on this idea about the power of the heart, which has already been referenced in the chat and in the presentations. Just the perfect expression of what we're talking about. And then I found also a really nice illustration of it, which is that horses have a heart electromagnetic field, which is 5 times the extent of ours. It can extend up to 9 meters. And some of you might have heard of or experienced where horses are used in therapy or in helping children who are disturbed, and also actually in leadership training. And so when I heard this fact about the horse's heart, that really made sense to me as to why something powerful can happen in that field. And another little bit of research linked to that is that apparently in some research, each time a person sent a thought of appreciation to a horse, even though there might have been many people surrounding that horse, the horse turned and looked directly at that person. So for me, those are really powerful examples of the power of appreciation. So I put this next slide up to start to just make some keynote statements. We're looking at the language of the heart. We're looking at the wisdom of the heart. How do we connect with it more? And how do we bring it in more deliberately? I think we're all using it, but by actively working with it, we might be able to make more of it, bring it in more often. I think it's certainly something that could be needed in these times. So I put a link there for you to something called the Heart Math Institute, which has been pioneering the science of heart intelligence. And you can find a lot more of the research, for, like the example of the horse that I just shared with you. And just to reiterate also that this is not about excluding the mind, it's about bringing the two together, and that can help us to be wholehearted in how we respond and meet others. So I noticed an amazing question from Eve in the chat about how to help staff in care homes who, on top of having had a really difficult few months of work, are also receiving very painful letters from families who have lost a family member, presumably. And I just thought that there is no way that we can give a rule or a process. Each of those situations would have to be responded to individually, but I do think that bringing in the heart to each of those situations can be really powerful. And it brings to mind there is an AI principle of wholeness, and that is referring to the fact that there's a level where we're all one, and there's a level where all of us are whole, and somehow we need to talk from that part of ourselves as much as we can and connect with that part in others. And it was this morning that I discovered on Twitter the post, the blog that Sally has already mentioned, learning from staff experiences of COVID-19, let the light come streaming in. And it's such a great title. That's really why I connected with it. Although all the examples in it of what staff have been doing are very powerful, and they also link to what you've been saying in the chat. It also reminded me, though, because we've got a bit of poetry permission here, of the wonderful lines from the Leonard Cohen song Anthem. Ring the bells that still can ring, forget your perfect offering. There is a crack in everything, that's how the light gets in. So I think that, you know, in a way, this time is a bit about the crack in our world. through which the light is getting in. We can do the next slide now. And just a couple more references that I think you've perhaps come across elsewhere, but it's really good. I love to bring them in. And there's a book called it's called Humble Inquiry, The Gentle Art of Asking Instead of Telling. And for me, it's also a lovely summary of what happens in Appreciative Inquiry. And what's so important in that idea is that we genuinely must not know the answer to any question, even though it's a really simple one and it's one we've asked lots of times before. So what that's doing is that's reminding us that we need to invite in and be comfortable with the power of uncertainty. And I know that in these times especially, that uncertainty can feel really difficult and can cause us to feel anxious when we don't know what to do. And so this is an invitation to perhaps reconfigure our relationship with uncertainty. And it's a journey, I can assure you, but if we invite it and want to play with it, I think we can see its power. And this is a great example. So here's a quote from a spiritual teacher called Krishnamurti. One is never afraid of the unknown. One is afraid of the known coming to an end. And that seemed to me to speak to our time as well. So out of all this, the thought that's occurred to me is what we're doing is spacious inquiry. By our conversations, our attitude, bringing our heart into things, we're inviting others and we're giving them the space to share the wisdom of their heart and mind. So yeah, well, if that feeling and idea can help you, go ahead and talk about it, share it. Next slide, Dan. More around this idea of how we do a different kind of conversation, and because again we've got a little poetic theme going, I've chosen the poet David White, who some of you might know, a Yorkshire man currently living in the States, doing really lovely poetic writing. So these phrases on this slide have come from him. So giving up your idea of where the conversation is going, being the listening ear, asking beautiful questions of yourself, of life, and of circumstances. And the fact that we can find solace, we can find comfort, a place in the greater scheme of things when you ask beautiful questions in quite often unbeautiful circumstances. So what makes a question beautiful? How do you ask it? You don't ask a beautiful question with your strategic mind. That's needed, but the last place it gets articulated. You ask it with your body, you ask it with your longing. And you can ask a beautiful question in complete silence, with no verbalization whatsoever, just in the way you're paying attention. So this is, again, I invite you to be explorers, conversation explorers, appreciative explorers. Have a go at any ideas here that you think, oh yeah, I'll try that. And our final slide, Dan, and Tim will do this one. Next slide, please. No. Actually, actually, let me reference. Do you want me to reference that Sonia slide or not? Okay. Yeah.
Go for it, Suzanne.
Okay. So today obviously was a good day on Twitter because I also found this new infographic from Sonia Sparkles. I'm sure that many of you staff member, and in her spare time she does these amazing illustrations of concepts, and she shares them on her website freely, so you can access them there. But this seems to be very linked to the blog from Susie Bailey and Michael West, and that she's got some lovely illustrations of the changes that we might want to hold on to that have happened. And the one that just jumps out at me is that one about don't be afraid to bend the rules, do what is right. You see the ruler that's bent into a curve at the top one. So we'll share this with you to look at your leisure. And the slide with the questions, Dan.
Yeah, I'll just bring that up Tim, if you carry on,
Okay.
I'll find the
question.
slide.
Yeah, I'm just going to pick up a few things that Suzanne and others have alluded to. So those who have trained with me and with Suzanne will have known sometimes I refer to how AI is about shifting power. It is actually it's not evolutionary only, it's revolutionary. Certainly in the time of COVID, AI does fit so well because it is about changing how we do things and doing things differently. Secondly, is that I think there is a missing principle sometimes in AI, which I call the curiosity principle. It's part of discovery, it's the benevolent curiosity, finding out what's going on, what happened, what did I miss, what did I look for? And when Dan started off with my favorite quote of Dumbledore, which was chosen by young people for a book I worked with them on, How to Be More Awesome, and maybe the title is actually for you as NHS staff is How to Be More Awesome, or even more awesome than you are. So these questions are about really taking time to reflect. And again, a part of AI, in my experience, is helping you to reflect on your strengths, your skills, your abilities. So the first question is about reflecting on your experiences during COVID-19, the skills you can build upon. The second question, and what's been the biggest learning for you? How can you implement what you have learned? And 3, what is the smallest step you could take to support the well-being of yourself and also the well-being of colleagues? I'm asking you to think about maybe responding to those questions on the board, message board, but equally, after this seminar, take some time with either yourself or with a colleague, do a shared conversation around those questions, and then reflect upon what you've learned, what you valued about that conversation. And finally, I'd like to say kind of one thing. It's been an enormous privilege to be part and listen in on the previous 3, and to see people we've worked with and to see them grow and blossom with their appreciative inquiry practice. We're very privileged to be part of that and feel honoured in that experience. So, spend time now, or take it away and do it later on. Thanks, Dan.
So at that point, I'm going to invite some questions for the panel. So, and it's equally at this point, I'd ask if you feel comfortable for you to switch on your cameras. So we've been behind a presentation for most of the series, and it would be nice to see some of your smiley, beautiful faces. So if you do feel comfortable, then please, by all means, turn on your cameras. So in terms of the panel, we sent out with the 4th series that if anyone had any questions or topics that they'd like to ask, that they could do so. And I know we had a response from Alex. So if Alex is still on the call, if you'd like to unmute and ask the panel your questions. You're still on mute, I believe.
Is that better? Can everybody hear me? Cool, thank you. Hi, everybody. So one of my questions, what would you want to be the biggest impact from this series? Just a very open question, but that was something that really sprung to mind first. And the second one is, could we look at something like from this, a community developed presentation or something that we could take away from individual organisations, that we can actually, for something that can be shared to other people, so we can actually make it point. Yeah, they're my questions.
I'd open it up to the panel at this point. So the 2 questions about how we see the webinars being used and helping us further, and then almost a community creation of some sort that is helpful then back to trusts.
So Dan, I'm happy to start if that's all right.
Yeah, by all means.
I think it's the possibility of our connections being so easy now. I think in our institution, we've been thinking about getting more and more training when it came to appreciative inquiry, and this is really important. But actually creating a community where the foundations are strong, having Suzanne, having Jan, having Helen and Alison, all these people literally on our screens and talking to us and sharing with us their experiences, makes it more accessible, particularly to those people who don't really know what appreciative inquiry is or labeled it. They're practicing it every day, but didn't quite realize it was something that they were doing. And I think one of the things, again, that emphasizes this community that's been created out of this is getting an email from someone within my institution that I've not met before, who's actually doing a PhD looking at safety too in the intensive care setting. And that was brought to my attention through doing this webinar. So I think the power of connectivity and communication, ironically, when, as you say, we're not physically distant, but socially connecting. And that's where I think the biggest learning for me has come out. It's laying the foundations to carry through appreciative inquiry and make it part of the daily conversations. So can I hand over to someone else then to take over from that?
Yeah. Building on Sally's response, I actually think one of the things I'm doing at the moment, in response to colleagues in the NHS, is how do we develop our training to be more virtual? And building on things that Sally said, sharing people's experiences, more one-to-one coaching. So watch this space. We'll be developing training along those lines, which does mean those who are experienced practitioners in them can start using it themselves as a material. So we're starting work on that now as a response. And we've learned so much from watching this, being part of these seminars. It's given us great way of field testing some of the ideas.
That we produced a book to make appreciative inquiry practices more accessible to people. We were supported to do that actually by the West Midlands AHSN. It's called Reflections, and it's for sale on our website, but we decided to reduce the price as part of this time, just to help people who might want to access it. So we'll send a link out to that if anybody would like to. You're welcome to go on the site and get it.
If I just may give a quick reaction to the question about what is the wish to be the biggest impact of this series, there is a word I'm looking for now. It's within the COVID-19, the contamination. You have these, I don't know, how do you call them? The fast connectors, or the fast spreaders, or there's always a
super spreaders.
Yes, super spreaders. I wish you all to be super spreaders of the positive, generative outlook for a better future. Super spreaders. That's what you are, in the positive sense. Thank you.
From my point of view, I think what I hope to achieve from the series is to have a bigger reach to the care home sector, which have been in the spotlight with COVID, and to see how they can engage with the power of AI, not just through COVID, but generally in their work beyond COVID. And we've already started those ripples spreading with care homes, and we've got other organisations such as My Home Life also coming on board with those techniques. So that's great to see.
Secretive for now. I've got a few questions that came through, and I themed some of those questions. So if I can ask the panel just a couple of questions in turn. So for me, linking to those questions just is, what 3 practical steps could participants of this series take to move forward from going from surviving to thriving beyond COVID-19 using appreciative inquiry? And I think that's on 2 levels. One is a micro level for themselves, and then on a more macro level for their teams and their organisations.
Dan, one of the things Caroline referred to, and we had a conversation yesterday about this, but on the information going out from yourself, there will be a SOAR tool on your personal well-being. And that, I would suggest, either individually or in teams, is a practical way to develop your own well-being approach. It was co-designed with nursing staff in a hospital in Nottingham, and we know it's spread all over the country. But it's actually a very practical tool to support your own well-being. That's one practical suggestion to make.
Yeah, so we'll send the well-being SOAR out with the repository of resources after the session, and it is certainly a good one to use. I've used it in the past as well, so thank you, Tim. Any other practical steps on a micro or macro level from the panel?
It depends on how you define practical, but what I would say is be gentle with yourself, because if you are trying to cultivate yourself to grow out of the misery, is be gentle, because it's not going to happen magically one overday, sort of like overnight change. So listen well to your body. Take care of your body, because that is the instrument that you are working with to create a future. So listen to your body, take care of your body, and then take it one step at a time, getting clarity on what are my challenges, what is my reality today, and what is my challenges that I would like to prioritize to work on importance versus urgency, and then take one step at a time. But be gentle, listen to your body, get clarity, and then a journey is ahead of you.
Thanks, Jan. But one of the things that I came across, I went back to do some clinical shifts in ITU, and one of the things that was on the door of the very, very cramped changing room was a going home checklist, which a lot of staff I saw sort of referring to, and it said things like, take time to reflect at the end of your shift, to reflect on your day, and take time to think about and acknowledge the things that were difficult, and also the things that went well, and choose an action that signals the end of your shift, whether that be doffing your PPE or getting in your car, and then maybe switch your attention to home and think about and really focus on how you will rest and recharge. And I thought that was quite a useful, practical prompt for staff after their shifts, wherever they work.
If you feel comfortable, then if you'd like to ask the panel your question, I think that's a really great question to ask and to address, really.
Hi, my name's Tom Rollinson. I work for the East Midlands ambulance service. So I suppose a specific interest looking at quality improvement. So, you know, I used to work with Helen. I'm particularly interested on the practical application of how this links with quality improvement, human factors, patient safety. You know, seem a lot of buzzwords which get thrown into the mix, and it's so confusing for. I mean, I've done a master's in this area, so you know, I kind of know the terms. But somebody who's on the front line, just kind of going, I don't know what to do. So I suppose from a practical application, how do all these things link together?
I can make an observation on that, and I think it's really helpful if we could. Actually, Jan made a great comment yesterday that not to confuse the tool that we're digging a well with the well and what we want to get out of it. And so it's really great if we can integrate them. And from our perspective, an appreciative approach fits into all of those things, into quality improvement, Yeah, into all of them actually. That it can, in human factors, and it can very subtly, if applied systematically, it can change them. It can make them more asset based, which sometimes they benefit from. And I think there's people on the call where I've given them AI training in relation to quality improvement, for example, and they just went off then and ran with all sorts of examples of using it. So AI can fit into all of them. My personal dream is for it to be an inherent part of all of them. But we're perhaps moving nearer to that. Who knows? Thank you.
Just with a reference to the application of appreciative inquiry to quality improvement, just simple techniques such as, for example, if you're doing some work with a care home around reducing avoidable harm from pressure injuries, for example, it's about valuing the role and appreciating the role of everybody within that care home, whether it be the maintenance man, because he services the beds that the residents lie on, or the cook who prepares the food that the residents eat, and that contributes to their tissue healing, the carers who reposition the residents, the admin staff who provide the paperwork for risk assessing the residents. It's about everybody's contribution. It's not just it's about appreciating the role that everybody has and bringing them together in setting that quality improvement aim as a team. So I think Appreciative Inquiry has lots of application within quality improvement, both in bringing the team together and planning their quality improvement projects as a collective project, and appreciating the value of everybody's role within that project.
Tom, I think from my point of view, I think we'll be looking as an IHSN how we can link some of those things together and pool all of that into one space rather than having separate conversations. And which approach and methodology do I pick up as and when, that you blend all of them. I think so. Jan, I'm just going to invite you to share a poem, and then I want to end for 1 minute after the poem because I'm conscious of time.
Okay, thank you very much, Dan. So yes, indeed, I would like to share a second poem I wrote. And let me see, let me see if I can share this. And there you are. So the poem is Every Teardrop Counts. Every teardrop counts. Even when you're in every drop, the world is upside down. Every one that falls I catch. With the salty solution which rinses my grief, I let loose bit by bit, closing something what others often do not see. But that is how I aerate my story, which I continue to write. My story, a slave with old melodies, but listen to the future music inside of me. How often can I not keep it dry, turning my eyes to hazy staring at something small or even big? Keep telling me how I, like today, grow. Tell me that again and again.
Excellent. Thank you very much, Jan, for this. So I've Jan's poetry throughout the series, and it's something that Jan did in Nice, so it was something I was wanting to capture. So then for the very last slide, if you like, of the series, not that one, I think this one. So I just want to take you through what's next as a closing sort of statement, if you like. So I'm going to go through this, and I want us to imagine. So the picture, when I was in New York last year, I took the picture, the central picture of Imagine. And we brought together a community, many of who may have known each other or didn't know one another. We had new faces and new friends on this journey. The journey doesn't stop here. So as an IHSN, what we're looking to do now is pull the community to continue the conversations going. So all of the resources are going to carry on in our Meridian site. So we're uploading some of those, and the repository resources will be there for everyone, and we'll send the links for those. But equally, then look at how we can.
Dan, we can't see a slide, sorry.
Oh, that's a shame. Let me stop sharing and try again. So I think it's just that notion of coming together, being in a space and continuing the conversations, and we'll allow you to see some of those and hear about some of those in the coming weeks. The last thing I want to do, hopefully you can see the slide now, is thank you all. Firstly, thank you to the IHSN for giving us this opportunity as a team to come together and share with you our journey of appreciative inquiry, which started long, long ago for many of us. And there's pictures there from Nice and Learning from Excellence and lots of different places, QI events, you know, where we've pulled all of those things into this series with friends. So thank you to the presenters, to the hosts. Equally, thank you to all of you that have joined us, giving us your precious time during, you know, these clarifying times. We wish you all the very best in your journey of what will give life. And we can't wait to hear about some of those when we pull together the community. But we will hopefully see you soon for more of these. But thank you very, very much.
Thank you, everybody.
And that naturally concludes our session. So we bid you farewell for now, but for too long.
Watch this space.